Okay, so coming back together, does anybody want to throw their thing out right now, just for the fun of it, to get some feedback on what they're doing? Uh-oh.
I can help.
Okay.
Okay, so I'll talk about mine. I need to use this. Is it recorded? Okay, good. Okay, good. I'll still use my nice guy voice then. Okay, so I was talking about wanting to do profiling, physician profiling and resident profiling, to see what data you can get out of the electronic health record that gives feedback to the resident that they would find useful. And one of the sort of the baby step toward that I thought was trying to determine what they number one want to know, and so that's like an open-ended question. I was hoping that their responses might have agreement, so it'd be kind of a qualitative study, and then also wanting to know what their feelings and concerns and hopes were for something like that, because there are a lot of ethical issues surrounding that. So I don't know, like my idea at first is just having a survey with 4 open-ended questions and asking 20 residents. I don't know what everybody thinks. I'd like to hear.
So I guess I need a definition of profiling.
Yeah, so, well, the definition that I gave you a little definition of what I said was just that it's data from the electronic health record that's
right.
It's feedback to me on how my practice compares to others.
Okay,
Now,
so it might be
something like turnaround times,
okay.
or it might be something like my antibiotic profile.
Okay.
It might be something like whether I see GI patients or whether I avoid disease or something like that.
Okay, so it's essentially it's mining the EHR to provide information on somebody's practice, essentially. And some places might use it as a dashboard, or some people might use it for they're all different titles for that. Okay. Trying to decide where to go next. I'm going to put that on pause for now.
Okay.
Because we're going to come back to them. Okay. Because we're actually going to try to define what a good research question is, and then we'll come back to that section there.
I'm sorry.
No, you're good. I asked for it, right? Because it helps to work on it. All right, let's do another one. Who wants to do another question? And it just helps to have these on the table to give a sense of what we're doing. Because he's got a very clear area which he wants to work in, which is important, right? If you're going to take a whole bunch of time to create a bunch of resident dashboards, you kind of want to know, do they want it? And if so, what do they want with it, right? Or are they going to see it as punitive because I didn't see enough GI patients, right? Something like that. Do you want to go? Here. I don't. If you all want to stand, I don't know. You all decide.
So Jeff actually helped me to be more focused. So this is the question that we're trying to figure out is, right now, we've created a 4th-year curriculum to assess some of their, like the last kind of semester of 4th year of like simulation, ability to take care of a anaphylactic patient and a respiratory arrest patient. And right now it is, whether or not they remediate is based on sort of how much time I have, and then that percent, like that bottom percent, like how many hours and what other faculty I can recruit, right? And so that many slots in the sim center, and then I just cut it off there, and those are the students who are invited back. Please don't report that back to my students. Oh, you made the cutoff because I had, to work a shift that day. Okay, so, but that's kind of what we're doing, right? Is it is like, these are the students who score more poorly, but we know that it should be more robust. Like, we really should have a more rigorous cutoff of who actually does not have this skill. We call it extra coaching in practice because students hate the word remediation. They really respond better to extra coaching in practice. But it's like, we know that it could be more rigorous of like really who needs the extra coaching in practice or remediation and why, and not just based on how much time I have.
Okay, that's an easy question, right? In some ways, it's just, like you got to set a standard, and then when you pass the standard, then you make it or don't make it. So that was like, that's an easy one. But it's easy in terms of there are lots of different ways to do it. There's something called standard setting, and so literally there are 3 or 5 different techniques. It's usually the usual one is called the Hofstee, and there is something called a standard setting. And I don't think I've seen a standard setting paper in emergency medicine. And when I'm sitting here saying to you all, there's these standard setting techniques, you're like, not heard of that. So publishable, right? Just doing the standard. Not how many students met it or didn't meet it, but just saying that you made a standard and this is what it looked like, how to go about doing it. Does that make sense? Do you want to do one more? All right, I'm going to keep going a little bit here and do this. Okay, so we've done our share here. I know I should have a thingy. Okay, so the question is, where do research questions come from? We just dig in for. Okay, good, thank you. All right, the question is, where do research questions come from? So I think, as we talked about, it often comes from the work that we're doing, right? The real life experience that we're working on. So kind of like maybe the observations, things that you're seeing. You might do it. Problems encountered with learners. That's our how do we fail people. You might do it just in terms of the environment, because I think Jeff's question in terms of, are they interested in physician profiling? You might do it in terms of a change. So if you're going to add physician profiling or some sort of a dashboard, you actually want to measure it before and afterwards to see whether or not there's a difference, right? You might do it anytime there's a measurement thing. Who is our measurement? Or a cardiac echo is a good measurement question. You might do it in terms of how do you teach. So how do you actually teach cardiac echo? I think your question was, how do you teach OB ultrasound, and is that effective? So all of these then become questions that we might ask for the research that we do. And then personally, I got a lot of stuff out of something I read. I think my favorite thing is the New York Times, like the review. Like they come up with such great stuff in there. I think my favorite one was. And it took me years to get to this one. It was, patients love it when their surgeons talk to them about personal issues, and they hate it when their internist does. And I was like, what an interesting thing, right? And so it's because the surgeon is giving them their time, and the internist, they're taking away the time. It's just a very interesting concept. And so we actually did that in emergency medicine. We asked, if I sit here and talk about the time I bruised my knee, does my patient like it or dislike it when they're there with a knee bruise, right? And we think, I'm an introvert, and that's painful. I'd never talk about myself. But as it turns out, patients actually do like it when we use ourselves as educational material for their knowledge. Does that make sense? Or there's an empathy there. And so I read something in the New York Times, something I meant to come back to, studied it eventually. So I use that as kind of a fuel for fodder. Okay, next slide. All right, so we're gonna go through some be curious questions. Okay, next. So your chair wants to encourage education. All of our chairs do. They want us to be, good educators. You need faculty to engage in completing assessments, coming to grand rounds, and other sorts of things, right? You need them to fill out their resident assessments. You need them to come to grand rounds. You need them to, I don't know what else you need them to do. She's willing to allocate some of the money to this mission. What are you going to do? How are you going to solve this problem? You can debate that with her. Part of the stipend, so it's part of whatever, it's part of your incentive pay. Yeah, go ahead.
I guess the first thing would be to do a needs assessment to see if you can get any more granular information about why they are not doing these things.
Okay. Okay, so you could do a needs assessment of why faculty don't do their assessments. Haven't seen that published. I don't read everything, to be clear, but I haven't seen that, so you might start with a publication on that. What else?
Qualitative review of why it's important, why certain amount of assessment is important, or finding that balance of where the assessment need is, or where the most important and impactful metric is for grand rounds or assessments.
Okay, so I think going back to kind of like why are they doing it, why are they not doing it, trying to do some sort of proving of why it matters. Good. This is so funny. I'm an ER doc, right? So I just do. I'm a bad needs assessment person. I'm a bad education person. This is Michigan. We just instituted an educational value unit thing. Like, if our program director wants people to do their assessments, and she wants people at grand rounds, and we want people teaching, I'm just going to count it. And basically, we set a bar. We said, you got to do 30 hours of educational value units. If you do that, you get 1/4 of your incentive, which is like $2,000, which is not usually enough to motivate anybody. But they didn't want to be ashamed with the chair. And so we just did it. We just launched it and did it. And it worked, and we published it. And so that was a implementation of an education value unit. So the things that you just do, you can publish. You could also do the whys, right? But it might be a little bit more difficult. Does that make sense? Okay, next. So the milestones need to be assessed through direct observation. Your program director asks you to head this initiative, right? So you need to be doing milestone direct observation. You realize that an attending is present for critical patients, right? In a resuscitation, there's always an attending there. So how might you do the assessment? What are you going to do with this one? These are not trick questions. These are like easy questions. What are you going to do? Put a checklist in their hand. Great. What kind of checklist? A good one. Okay, good. I love it. It's a good one. How are you going to decide what a good one is? Anybody? We're going to do a Delphi consensus. Does anybody know what a Delphi is? Or can you describe it kind of vaguely?
It's just multiple rounds with an expert subject matter group where people essentially pitch ideas to go on the checklist and then vote as a group on which ones they believe should be there. And eventually, after a few rounds, that'll winnow down to a consensus list that is
Exactly. Good. And so we could publish our Delphi consensus list. We could publish for this group, what we actually did is we did something similar to that, and we created a checklist, and then we decided we were going to test it out on videos to see whether or not there was any sort of agreement on the videos. So we basically had 15 faculty watch a video of somebody in resuscitation and fill out the checklist. It was terrible. So next slide. And so we published our bad study, our failure, because we couldn't get reliability with it. And that's because everybody has a different shared mental model. Even though we had created this checklist together, everybody thought about it different. Didn't work. Still could publish. Okay, next. So you're irritated by having early medical students shadow you. None of you are going to admit to it except for me, but I don't like having medical students around, like kind of to follow me around. So what are you going to do? Literally, what do you do with those students if you're working with them? What'd you say?
You assign them to the intern?
Assign them to the intern. What else?
Ask them to do things. Go gather pertinent information.
Great. Go get a history. Ask the allergies. I always forgot, right? Did the medication work? What else are you going to do with them? Triage is great. Pharmacy is great. X-ray is great. Like talking to parents is great. All of those things are great. And so there was a faculty at Michigan, and she had a list. She actually had this thing in her pocket that she used to pull out when she had students. She's like, oh, well, they haven't been out to triage yet. She'd send them out to triage, right? And so basically, she and a medical student and a couple of us put together this list of what to do with medical students when you don't want to deal with them. And we published it. It's called Beyond Shadowing. Now, it's framed in the positive sense of like, this is the good things that you can do, or these are educational experiences. And it's actually very nicely organized by if it's an early medical student versus a later medical student, because their tasks can be quite different. The students actually loved it, and the student actually is the first author on this, because he really kind of took it under his wing and said, this is what's helpful for us. So my point with all of these is this is the broader sense of scholarship, and not necessarily the research sense of it. Does that make sense? Is that you can do these interventions, you can do various things, and you can still publish them if they're relatively novel. Okay? All right. So, do you all want to go back to your scholarship question at this point, or do you want to keep going? Yes, we want to go back to our scholarship question because we went through. They said yes. Did anybody? Okay, let's work on refining our scholarship question a little bit better, because I think we gave you some examples. We talked about just doing this one. Let me just come back to the physician profiling one. And so I'm going to try to restate where you are. It is that you're going to implement some sort of resident clinical performance dashboard using the electronic health record, and you want to know what is the effect of it is, or how they're going to respond to it. Is that right? Is that the question?
Yeah, I want it to be an informed development
Okay.
based on things we want to avoid or include
Okay.
based on what the residents feel.
Okay. All right. Does anybody? I don't know if there's any Stanford people. Are you Stanford? Has anybody done design thinking? Has anybody been in a design workshop or design thinking? Because I might approach it that way. So design thinking is a specific kind of approach to doing something similar to what you talked about with Delphi, meaning that it's a kind of a methodology, and it's where you really kind of brainstorm out and then close down in. And so sometimes I might approach a problem that way. But
I worry when
actually,
take
I'm gonna.
alternative approaches like that like you don't have a p-value, right? And so
None of these had p-values. So none of those studies had p-values, and it doesn't matter.
Could you do almost like a Kearns type breakdown where you go through and then you do your first needs assessment, then you do a targeted needs assessment, and you get just some data from actually
Yeah. So Kern is it's Stern's 6-step guide to curriculum development, and it's a series of intentional steps. And the first one is a general needs assessment, then a targeted needs assessment, and then I'm not going to get them right, then a curriculum development assessment, evaluation, those sorts of things.
Kind of like an educational tool, I guess that makes sense.
Yeah, yeah. And I have published using Kearns on it at times. All right, I'm going to send you back to your questions, and I'll continue to circle